So Dr. Sabrina Solt is our guest, and just for people that don't know you, could you give yourself a little introduction, please?
Yes. So I am located in Scottsdale, Arizona. I practice regenerative and anti-aging medicine. So I do a lot of stem cell-based therapies, using everything from stem cells from your own body, so your own fat, your own bone marrow. We use birth tissue products, stuff from umbilical cords, exosomes, a lot of PRP. We do hormone replacement therapy. We play with peptides, IV therapies, all that sort of fun stuff. I have been carnivore since January of, I think, 2021 or 2022. It was 2022. I'm losing track now. It's been coming up. It'll be 3 years this coming January. And I mainly went carnivore for health benefits at that point. I was struggling with really severe IBS, acne, chronic pain, anxiety, rough state. After about 6 months of being carnivore, I had healed pretty much all of those. And I was convinced I now make carnivore a really big part of my practice and incorporate that to really accelerate healing with a lot of the other treatment plans that I do for people. Big advocate for it in general. And I like to really help people try to troubleshoot why carnivore isn't working for them. And I think there's a lot of nuance to that depending on the individual. And I've had the pleasure of working with many, many carnivores over the last few years, running labs on them, seeing the various things that pop up. Picked up a lot of really cool patterns as far as why things don't work out. And it's really great trying to, really getting people to that good spot after they've had a struggling time with it.
Wow, that's a good introduction. A million times better than I could have done. So Richard, do you have a question? Because I've monopolized doing the questions.
Yes, you are the question man. Are there any in the chat there that we can?
Yeah, there are hundreds. But yes, no, but do you have a question?
So the exosomes, I would like to know a little bit more about, if you can explain that you just mentioned.
Exosomes. Okay. So exosomes, in the context that we're talking about them, is their stem cell secretions. So they're manufactured by companies who will take stem cells, usually from a placental origin. Some companies use a bone marrow origin. They put these cells in specific conditions that allow them to kind of, we'll say, get stressed out and release what are called their exosomes, which are these tiny little messengers. And they contain usually messages to help heal things, repair things. And they're great as an addition. I don't love exosomes necessarily as a standalone treatment, though there are a lot of doctors that use them. I've personally just been really underwhelmed. When I like to use them is when we have a patient who has a very pronounced inflammatory picture. So maybe somebody who has an autoimmune disorder and they are just very, very highly inflamed. We might use exosomes to help kind of calm down some of that very big systemic inflammation. Say if somebody's coming in for a knee treatment with, PRP or maybe adipose stem cells, if the knee is in a state where it's very hot, very inflamed, very damaged, we may use exosomes to help calm that down. Topically, they're really great if people are doing things like microneedling treatments or laser treatments. I don't do laser, but I do use microneedling, and it's fantastic for helping to reduce any redness from the microneedling, helping to repair any fine lines, wrinkles, acne scars. They're pretty cool.
Fantastic. Fab description there. Any questions we can jump on, Steve? I think.
Oh, yeah. Yep, there's loads.
Oh, there we are. Fantastic. There we are. I knew there'd be plenty coming in. I can't see the questions as well as you can.
Okay, please ask Dr. Solt if lower thyroid levels on long-time zero-carb carnivore can result due to not needing to use it for processing glucose.
It's a hard question to ask because low thyroid levels always have to be correlated with a patient's symptoms. So are you low thyroid and are you experiencing the symptoms of low thyroid, which for people who don't know are going to be things like really cold extremities. So are your hands and your feet colder than the rest of your body, or in comparison to somebody who's next to you who's got a normal thyroid function? Are you dealing with constipation? And when I say constipation, I don't mean the slower transit time that a person might get when they are on carnivore for a long period of time, where they just have less frequent stools. It's legit constipation where you have a difficult time actually passing it. If you are having any degree of fatigue accompanied by depression that feels like there's just like this black cloud over your life and you just can't get happy, That's another low thyroid symptom. And then, of course, the ones that most people think of, like your hair falling out, thinning hair, eyebrows thinning, dry skin, brittle nails. Those are all the things that you should be looking at. So say somebody comes in and their labs might show lowered thyroid function. And we should actually break down what low thyroid function means. So when you go to your normal family doctor to check your thyroid, they may just order something called your TSH. And your TSH can fall in a range from basically just above 0 to most reference ranges will say somewhere around 4.5. They'll tell you that your thyroid is normal as long as your TSH falls within those ranges. Those of us who practice on more of a functional or root cause side, we will look at more narrow ranges. Basically, we want your TSH to be no more than about 1.5 or 2, and ideally less. Anything more than that, we know the thyroid starts to overwork and you actually run the risk of other thyroid disorders happening. But that's only part of the picture. That just tells us what the signal that's coming from within inside your brain at the pituitary level is like telling your thyroid. So that's one level. Now, at the level of the thyroid, when that signal comes in, that TSH comes in, and it tells your thyroid, hey, go ahead and start releasing thyroid hormone. The first version that the thyroid hormone exists in is something called your T4. Now, T4 is the inactive version of thyroid hormone, and this inactive version requires various other nutrients to actually do the conversion to the T3, which is the active form of thyroid hormone. So those nutrients are usually zinc, selenium, iodine, B vitamins like your B12, and then that conversion happens to your T3, which is the active form, and it's the one that does all of the work. So when I'm looking at a thyroid panel, those are usually the ones that I want to see at the minimum. Sometimes we'll run like an anti-TPO to check to see if somebody's dealing with Hashimoto's thyroiditis or Graves' disease, which are the autoimmune thyroid disorders. When we're looking at those levels, people will want to say, okay, T3, because that's the one we really care about. That's the one that's doing all of the work. Are these levels low? Most people, we like to see levels sitting at about 3.5 or above, just depending on the individual. So anything lower than that could be what this person is referring to with low thyroid levels, so to speak. And it always has to be correlated to a patient's symptoms. If they're not symptomatic, if their body temperature is fine, the skin's like supple and juicy and not dry, there's no hair loss, nothing like that, probably okay. And so I feel like a lot of people get kind of carried away on this thyroid train, and they'll start doing things like, oh, I absolutely need to supplement iodine, or I need to start like doing all these things for the thyroid. But if you're not symptomatic, you probably don't need to touch it. And you definitely, and the contrary to that, if you are symptomatic and your doctor is telling you that your thyroid is normal because all they did was check your TSH, definitely get a second opinion on that one too.
Brilliant. And that's the but that's the sort of thing I say all the time, because people come to me with bloods, and it's all about clinical presentation, and it's not about numbers in isolation. Just isn't. And we're all different, and you could take the test an hour later and those numbers will be slightly different yet again. You can eat Oreo cookies and bring your LDL down. So there's lots of things you can do. Anyway, I got a lovely question here. Why are we unable, we're in the UK, by the way, but this person isn't. Why are we unable to use live stem cells in the US?
We can. I will explain this. Okay. There's a lot of nuance in the stem cell world and in the stem cell industry. And there's different ways that we can use things clinically. And clinically speaking, the best ways to get real live stem cells for use in an individual is harvesting them from their own body via their fat or their bone marrow for use that day, like in that moment. That's how you guarantee it. We do that a lot, all the time, almost every day that I work, we use stem cells and we get really, really amazing results for people. What you may be referring to with this question is two things. One, the birth tissue market. So the birth tissue market refers to, or I'm using it to refer to, anything that you would, that a company, not me personally, but a company would acquire from a full-term live birth, thoroughly consenting and screened mother who has not, her or the baby have not undergone any harm, any coercion, anything negative, anything, that was really sensationalized in the early 90s when they started talking about these embryonic stem cells and stuff like that. There's no ethical considerations whatsoever in what we do in the United States. Now, once that tissue is harvested, and it can be everything, it can be the placenta, the umbilical cord, even some of the amniotic fluid, that gets sent to these companies, and they're usually recovery agencies. from that recovery agency, they usually have manufacturers that they will send it to. So one manufacturer might get the umbilical cord, one might get the placenta, and they'll make various things from that, right? So you have some companies and they specialize in the wound care space, and they will actually use the membrane of the placenta to make these patches to help heal non-healing wounds. So people who are diabetic, stuff like that, who develop these crazy wounds, burn victims, it's really incredible stuff. You can see some really amazing results with that. But once that gets sent to the manufacturer, they make whatever they're going to make. So if somebody gets like the umbilical cord, for example, they might manufacture a Wharton's jelly injectable product that you could use in a clinical setting for a patient's knee, right? Put that in there. They can help regenerate the cartilage. It can help reduce a lot of inflammation. It can help heal up ACL tears, MCL tears, all that fun stuff. Now, those products, because of the way that they have to be manufactured in the United States and the FDA regulations that they have to adhere to, because it's technically a tissue transplant, does not often allow for the final product to contain a measurable degree of live stem cells. Now, obviously, there can be exceptions to this. There are some products that do end up containing that. But if we were going to talk about what is the best way to guarantee a live, real, true stem cell treatment, it's harvesting them from your own body. Other countries, there's vastly different regulations. You go out, to Mexico, you can go to Colombia, Germany, all these places and do different things. But yeah, we can definitely get the live stuff from your own body here.
Cool. They are coming thick and fast. The questions: are there any oral peptides or bioregulators that will help with weight loss?
Oral? Are we saying just oral peptides? So some pharmacies are actually manufacturing like the semaglutide is with the oral like sublingual lozenges. So people can still do those. And I know that it's a wildly controversial topic. And I will say I've actually prescribed these things for, I think the first time I prescribed one of those medications was in like 2021. And what I found was that people were getting dosed far too high, and that's where a lot of the side effects were coming in. And people are just doing it in the wrong patient populations. So when I evaluate a patient for whether or not they're going to be a good candidate for these products, it comes down to, are they experiencing a degree of insulin resistance? And honestly, if a person has triglycerides like over 80, I would argue they're in an insulin resistant state. And so my job at that point becomes, okay, how can we get them to a healthier state really as fast as we can? Of course, you can bring on the carnivore diet, which I usually do for most people. But using these medications in like small doses has allowed people to actually, one, it'll kick out cravings. It'll kick out like addictions to food type, to different foods, to even alcohol. I've had people quit doing like hard drugs like cocaine on these medications. We're talking micro doses, like a tenth or less of what the traditional doctors will actually prescribe, in a way that actually doesn't lead to things like muscle loss or muscle wasting. And you really only get the benefits of them. And long-term use has been fine. Weaning has been fine. I know I'm probably the outlier here because I feel like everybody like hates on these things. But when you have a person who, at least in my practice that I've worked with for years, and they don't get results doing anything else, and you finally bring this tool on board and it changes their lives, and they're finally at a place where they're not in this metabolically busted state and they can do the things that they like, their body can heal, like it's pretty profound. But so those are available. Those are great for weight loss. As far as ones that you can get just like over the counter, I wouldn't say that BPC 157 is a great weight loss one. I think that if your weight gain issues came from leaky gut and not being able to actually absorb nutrients, ergo your body is holding on to excess fat as a really rich fuel and energy source, then it might be helpful, but it's not inherently a great like a weight loss drug or weight loss peptide.
Fabulous. The Wi-Fi we're getting from you, by the way, it's a little bit choppy if you're thinking I'm very slow picking up the end of your questions. But anyway, Mike is asking, thyroid is a very complicated organ, yet many people blindly take iodine supplements just in case. Get tested and monitor your symptoms before deciding on a supplement. Where do you stand on the iodine supplementation issue?
I agree with this statement. I've actually had a number of patients where once we finally do test their iodine levels and they've been taking it, they will put themselves into a low thyroid state because they've overtaken iodine. It's fascinating because I've actually come across very few legitimate iodine deficiencies in my years of practice. That's usually not the main problem for people. In fact, I would actually argue that a selenium deficiency is far more rampant than an iodine deficiency. Yet iodine is the one thing that gets the most popularity in the in like thyroid world. But selenium is one of the key minerals that's required to actually do that transformation from T4 to T3. It's called the deiodinization process, and I'm probably butchering that name, but it's a changing of where the iodine molecule actually sits on the thyroid. So it's I usually look to selenium more than I look to iodine.
Yeah, and do you use the iodine clearance test to look at deficiency?
I usually just do a blood test to actually see what the levels are doing. There's so many different ways that people will say, oh, you need iodine. Like they'll tell you like, oh, put betadine on your skin and see how fast it absorbs to see if you actually need it in your system. I'm a fan of just taking a blood sample.
Right. Okay, cool. Richard, any questions? I don't like seeing you sitting there quiet. It's just, I'm not used to it.
Yeah. 17 hours in, I think I'm probably feeling a little bit depleted, to be honest. And I'm probably out of my depth in regards to Sabrina stuff, but that's why I keep reverting back to the questions a second. But yeah, there's nothing for me to throw into the mix currently, unless there's other questions in there.
Well, I want to ask you a question, Sabrina. I mean, you had a child, didn't you? And you did it at home, if I remember rightly.
Yeah, I've actually had 2 babies at home. 2 out of 3 were home births.
So what was the reception from the people around you when you said you were going to do that? Were they worried or?
The third one, no. So my second baby we conceived during COVID. He wasn't necessarily a COVID baby, but we'd already been trying and it just happened that way. And it was at the point where they were saying that fathers couldn't be in the delivery room with their wives or with their partners for the birth of the baby. And I was like, well, there's no way in hell I'm doing this without my husband. So I was like, well, what are my options here? If I can't deliver in a hospital, maybe a birth center. Okay, I didn't really love the idea of that. And I was like, well, wouldn't I just do a home birth? So I found a great midwife team. I found a great doula. And I had my second child December of 2020 at home in a tub. It was amazing. It was probably one of the best experiences of my life, like right up there. And I loved it. Like I was like, if I ever have another child, this is 100% what I'm going to do. We got pregnant again. And I will say carnivore makes you extremely fertile. If people don't know this, I mean, we have the amazing Dr. Kiltz in our community who does fertility, and he uses, of course, carnivore with his patients. But my second baby, I finished nursing him. I got pregnant almost immediately after we were done nursing. And so this third baby, I was like, well, I want to just see if I can do it all on my own. I felt like I could monitor myself as being a physician if there was anything that seemed weird or abnormal. And what I also thought to myself was, I don't know if I really need to pay somebody to babysit me, because that was kind of, I had a great team and everything, but the second time I just felt like they were hanging out. Like I was doing it all. My husband was there, like adding support. They would check on things once in a while, but I really just felt like, oh, I'm just being babysat to a degree. So the third one, I was like, well, I'm going to have what they call a wild pregnancy and a free birth. And that's what we did. We had a doula present. What she basically did was she helped with hip squeezes, which is like the best thing when you're going through labor, is to have somebody squeezing your hips and providing that counter pressure to your body, basically trying to explode. And she took pictures, she helped with videos, and she helped with cleanup afterwards. But yeah, did it at home. My husband actually caught the baby. Our 2 other kids were there. It was just the best. And nobody's ever really given me shit for it. I think they probably just, they're like, hey, she did it. It's great. Because, worst case, if something does go wrong, you'll go to a hospital usually.
Yeah. I mean, I love that you did that. And when you talk about childbirth, it does seem like hospitals just want to take over and they don't want to listen to people's wishes. That's some of the things that I've heard from people that I've coached. They feel like they're they're completely powerless to make any decisions. And I think one of the ladies was saying that she'd read up about the umbilical cord and she didn't want it cut straight away, which seems to have a stack of evidence that that is actually not the best thing to do. And they just flatly said, no, we're going to do that. And she said, I'd like you to not do that. And I think it's incredible how they try to take ownership of your body. So more power to your elbow, as we say in Britain. That was brilliant that you did that. Right. I've got a couple of other questions here, if you don't mind. Let me just get this one. This is quite off the wall, really. Is there a reason sardines satiate me very quickly, yet I can binge on 80-20 ground beef and feel hungry again soon after?
It's a good question. I never jumped on the sardine popularity bandwagon one. I can't get past the smell to put it in my mouth. It's just not going to happen for me. But it could be that there's a different fatty acid profile that could be triggering your body in a different way than the ground beef. That would be my guess. I honestly it's such an interesting scenario. And I feel like that was what most people found, is that when they were doing this, because it was like all the rage. I'm sure you guys saw what everybody was, bunch of people were doing this like sardine challenge, this like sardine fast. Props to them. I don't have that. I will birth kids naturally at home. I will not eat solely sardines. There's just certain lines that I have. But I think it has to do with probably just a different fatty acid profile, just getting probably more of the omega-3s than you're used to versus omega-6s. That would be my best guess, because it's not going to be that wildly different as far as the protein goes, at least. So
yeah. I mean, I can't relate to that because it doesn't seem that would hold true for most people. I think sardines I could eat quite a lot of. But anyway, thank you for attempting to answer that, which is really good of you. Let's have a look. Now, this again is quite an abstract question. Please share some examples why carnivore isn't helping people. I've seen a few people say they didn't lose weight or their joint pain didn't go away. And can I just put my little 2 penneth in first, Sabrina, if that's okay?
Yeah.
I think some people give up before trying everything. And this isn't blaming the person, all right? Because I can use me as an example. Sometimes you have a pain, and I thought I had joint pain because at 60 I was playing soccer, and that's what's going to happen because I had some extra coaching sessions. I started getting a bit of knee pain, and I thought, I'm just doing it more often. And then I took coffee out of my diet, and my pain went away. So the point I'm making is, you might be giving up before you've tried everything because, let's say you do carnivore sort of like an average person that everyone else is doing, and you don't see the joint pain go away, but you kept coffee in. That might have been the reason. It might not have been carnivore, or you might not be eating enough, or you might be eating one type of food that doesn't agree with you. So I think for me, it's really difficult to get. I can't actually think of one example where anyone said to me, I'm giving up completely. It's never going to work for me. I've tried everything. Because I mean, I know I've been doing it 5 years, carnivore only, and coaching for over 15. So I can't give you any examples of anyone where it hasn't worked, hasn't worked. They've stopped. So, but anyway, what about yourself, Sabrina?
Yes, you totally hit the nail on the head with that, is that sometimes you do really have to exhaust these various options. And I will say there are some things that you need to look at from a deeper level too. At least that's what I found clinically. Now, I will say every doctor has a bias. I say this all the time. It's that we see what's coming in our office. I see the people that need help. The people who are fine aren't coming to me. So therefore I'm not analyzing their cases. It's just, that's what I'm biased towards. So there's, I think, a difference between people who are coming to carnivore because they want to lose weight versus somebody who is actually dealing with like a chronic condition, like say joint pain or some sort of other autoimmune disorder. I'll share one example because there are almost infinite examples as to why the weight isn't coming off for somebody, but I will share one that I don't see talked about nearly enough. And it has to do with the concept of a carnitine deficiency. So when somebody switches from a standard American diet or whatever diet they were eating before, they generally go more towards obviously the high protein, the high fat, very, very little carbs. And initially, some people see benefits, or some people it doesn't shift right away. And this has to do with the concept of having to switch your fuel sources. So most people come from being sugar burners, and then a lot of us will get into a state where we become keto adapted. We start using fat and we start using ketones for fuel. And those are the only ways that you can make energy, right? You can run on glucose, you can run on ketones. That's really it. So when you see somebody start switching over and they're switching to carnivore, switching to keto, and they're eating maybe high protein or they're eating higher fat, maybe they haven't metabolically switched yet. So they can have a hard time burning their fuel, running on what they're eating. And then that's not going to help them actually lose the weight, because you still have to be in some degree of a deficit to get that fat out. But then there's this other part that people, I think, are missing to a degree. And it's this idea that when you do switch to this metabolic fuel, what has to happen is this activation of this carnitine transport system, whereby that carnitine is actually going to be the thing that pulls that fatty acid into the mitochondria to be used as cellular energy. And when you start getting these fat levels up, these ketone levels up into a person's diet, they can actually run through their carnitine stores very, very quickly, sometimes in a month, 2 months, 3 months. And now you're getting this fat loss resistance because they are unable to use that fat as a fuel source, because there's no more carnitine left in their body to actually transport that free fatty acid into the mitochondria to be used as fuel. And this can be from a number of different reasons. You can actually have genetic variations that code for how your carnitine transport system works. You can have what we call a relative carnitine deficiency, whereby it's not that you actually have none in your system, but the needs or the demand goes up because of how much extra fat is coming into your system. And so sometimes something as simple as just paying attention to that can actually shift the needle for some people when they've reached this weight loss stall. Their bodies isn't actually able to keep up with it. So again, and there's so many other things on the weight loss side, but I really don't hear people talk about that thing very often. As far as the other reasons why carnivore might not help people, one of the other big things that I really see is due to chronic infections. So things like mold, Lyme, Epstein-Barr, any chronic infection in the body that isn't being treated appropriately, even like SIBO, H. pylori, stuff like that. You know, carnivore is great for reducing inflammation. It's great for helping making sure your immune system is functioning properly. But there is honestly sometimes a time and a place to take greater action on killing off something that shouldn't necessarily be growing inside you, especially if it's something that's zapping a lot of your resources, right? I've even seen really intense parasitic infections decimate people's thyroids, put them into what we call like a pseudo-diabetic or insulin-resistant state, start eating up a lot of their nutrients for them so that they don't get it. It can be detrimental. I've got a toddler in here. Sorry, buddy. I'm still on the call. I'll come see you in a little bit, okay? Anyway, so I would say those would be my top two on each side. With the joint pain stuff, though, I can speak to this. I had really severe chronic pain in my upper back and neck, and it was random things that would trigger it. But what I actually came to learn was that it was mainly lectin based. So lectins in general were the things that were triggering my chronic pain, and people will still have lectins in some of their products. Like if they're eating like tomato-based products, like if they're doing like salsa as a seasoning or something else that's in their system that maybe they're not registering as like a full carnivore food, that could be it. Or even oxalates too. I know I also was sensitive to oxalates. I would eat a ton of spinach, but raspberries, if people are still like flirting with the animal-based diet, they're not ready to go full into carnivore. Raspberries, kiwis, those are fruits that are still very high in oxalates and could still be damaging you on that joint pain side. So I agree with you. I think that most people have not exhausted the depth of the troubleshooting when it comes to like the whys in order to really try to figure it out. Well, we're going to have a guest with us, so.
Excellent. Oh, look in the background there. Very nice. Right. So
my middle child, and then you want to come show me your teeth, buddy? He has the most perfect teeth I've ever seen. Oh, look up, smile. Most perfect teeth I've ever seen. No braces, nothing. Most perfect bite. And he was weaning and like eating real food when we were carnivore. So I think that like part of the reason why he has just like the best teeth ever naturally is because he grew up eating carnivore. It's pretty awesome. Right, buddy? Yeah. Breakfast. What'd you eat for breakfast? You had a sausage, ground beef.
Yeah.
Yeah.
Yeah. It's too much on muscles.
Yeah, you also show your strong muscles. Good job, buddy. Yeah, he's showing his strong muscles. He's great.
Yeah, they're bigger than Zach's, aren't they?
I think they are. He's yeah. Are your muscles bigger than Daddy's?
Yeah.
Do you want to show everyone your big muscles?
Yeah.
Yeah. Yeah.
Yeah, we love it. We love it. Right, Gigi's asking, interested in knowing any success with reversing the bony finger joints caused by arthritis. Any reversal and any help in that area?
So this is really interesting. I've actually had a number of patients. So the bony arthritic changes in the hands can be due to osteoarthritis, or they can be due to rheumatoid arthritis. The rheumatoid arthritis is going to be more about autoimmune arthritis, and it's going to destroy the joints. Like it's really going to like eat them away pretty darn rapidly. And that's where you'll start to get the deformities, where people's fingers will actually start to move sideways as with those deformities. Thanks for the kisses. And my aunt actually had that. And I strongly believe that the reason that hers was so severe was because of her diet. And I believe there was like, she's an Italian lady, like grew up in Italy, making the pastas and the breads and all the tomato sauces. That's lectin city. And so there's, okay, go, I need you to go, buddy. So when we talk about lectins actually specifically, and I will kind of segue to this for a second because I think it's important. There is something in the body called the NLRP3 inflammasome, and you don't need to know that, but it's this pathway that creates inflammation in the body that lectins specifically activate that can trigger something like rheumatoid arthritis and actually make it worse. So this is where we actually see things like rheumatoid arthritis being caused by things like a gluten intolerance. It doesn't even have to be celiac disease. It could be a gluten intolerance. Just because of how it triggered this inflammasome, and it triggers it consistently over time to the point where your body can never actually get out of that inflammation cycle. And then you end up with rheumatoid arthritis or other autoimmune disorders. But if you have it and it's just due to osteoarthritis, so overuse injury or something else, castor oil over top of the hands with like gloves on and a heat application consistently, like we're talking every other night or even nightly, will actually start to reduce some of that. I've seen it in patients a number of times.
Excellent. Rich, did you want to say anything? Because I see you nodding your head there and being impressed with the knowledge.
Yes, just taking in, as we say, I think the last couple of hours beginning to take effect. Yeah, I mean, there's lots to come back to there in regards to autoimmune issues and lectins. The reason carnivore wouldn't work, I think a number of reasons. Again, lectins in things like burgers and sausages, whether you can buy from the supermarket. This is why I think we should always make our own burgers if we are making them. My local butcher will make me rusk-free burgers and sausages. Again, the lectins, as you say, they're found in tomatoes, bell peppers, and many other of the so-called keto-friendly vegetables will bind to the insulin receptor and will signal the body to store 5 times more fat than a diet without them. So again, it comes back this insulin response, the inflammatory processes, again, through NLRP3. So many different reasons why carnivore wouldn't work. A2 milk, a lot of carnivores will drink A2 milk. We mentioned about double cream earlier. All of these things, we're not saying that you can't consume any at all, but they are tools depending on where you are within your journey, and I think it's very much an individual thing. I used to drink an awful lot of cream. I used to eat an awful lot of cheese. I eat a lot less cheese. I'm still guilty of eating cheese. I do believe that casein can be problematic. One, because it's highly addictive because of the casomorphine, but also casein is a known contributor to intestinal permeability. But I am a big believer in the intestinal permeability from casein is far less likely if you fueled your gut from a boost from lectins. Far less of it with, there seems to be more or less susceptible, and should we say, for people living a stricter carnivore lifestyle. But again, these are all things, and the fact that cheese and cream and milk are highly addictive means that we end up consuming more of them. And I think, as Stephen said, people just don't give it long enough. They don't look at all the alternatives. There's lots of swap outs that maybe they will consume. There's things that they will they will consume, and which could heavily slow down someone's progress. And again, you mentioned the carnitine shuttle, essential for beta oxidation. What I would throw into that is, what are your thoughts on, from an energy perspective and maybe not a weight loss perspective, the use of caprylic acid, C8 MCT? C8 will breach the mitochondria directly. It doesn't need to go through 1 and 2. I find that helped me a lot in regards to the energy aspect of gravitating into a ketogenic and carnivore-based lifestyle, because there is a process of adaptation. But I did find that C8 helped me at least have that energy boost in the beginning, when maybe my body wasn't adapted, and it could have been, as you say, through the carnitine shuttle not being upregulated enough. But the C8 definitely helped me, I believe, at least in the production of beta hydroxybutyrate.
Yeah, I think that's an important point. Like, people can supplement things, and I think that I wouldn't say one of the more harmful messages, but I think that there's this message sometimes in the carnivore community that you shouldn't need to supplement with anything, that carnivore by itself is enough and you will get everything that you need from a carnivore diet. And again, I don't see the patients that are doing fine. I don't see the people that do carnivore and they're super successful right off the bat and they have no need for my help. But what I will say is that the ones that do come to see me, they came to carnivore because they were sick. There was something wrong with them. Nobody comes to carnivore because they're like, yeah, I'm just going to give up everything that I like to eat, everything that's really delicious, everything that's going to not make me a weirdo when I go out on social events, just for funsies. Maybe there is, who knows? But I haven't come across them. It's people are sick and they're sick and tired of being sick and tired, and they want to change, and they feel like carnivore is the best thing to help them. And it's harmful when people tell them they can just do it and not take supplements and muscle through it and carnivore harder, because they can use these tools. They can use something like a C8, or they can use exogenous ketones, or they could take a supplemental carnitine or supplemental iodine or supplemental selenium or anything else that their system might need, because they've already been in such a depleted and disease state. Obviously, if the body was healthy, it wouldn't have been in the state that it was. And a body is really only going to be healthy if it is given all of the essential nutrients that it requires to run appropriately. And that's only part of the picture, right? You still have to manage your stress. You still have to sleep enough. You still have to have a purpose. Like, you still have to have joy. There's so many other factors to this. And if you need to use a supplement short term to support the body to get you the results that you want so that you eventually don't need it, I am 100% for that.
Yeah, and that's refreshing to hear as well, because we've had so many different guests on, and I think the general consensus across the board is that an animal-based lifestyle, an ancestral appropriate lifestyle is the key to optimal health. But it looks like everyone has different approaches to this. Some would say that, it's all or nothing. My personal approach was through incremental changes. So I came from being type 2 diabetic and clinically obese and suffering with chronic fatigue, depression, anxiety, arthritic pain, so on and so forth. And the journey for me began with restricting bread. I didn't even know the carnivore was a diet or lifestyle when I began my journey. Keto wasn't even a thing in the UK. So it began with that one incremental change. And then it was a case of re-educating myself in regards to what true nutrition was, understanding the detrimental impacts of vegetable oils, and then slowly gravitating down this journey. So it's been a journey of incremental change for me. And when I felt that I was educated enough to part words of wisdom, I retrained as a nutritionist and I began coaching. I was all for super strict carnivore, the elite of the elite. Mm-hmm. But what I found was that very few people were actually willing to accept that was true to begin with, because we're told that fruits and vegetables are the magic elixir. This is where all of our vitamins and minerals come from. They won't resign to the fact that animal proteins contain everything that we need, not just to survive but thrive. But beyond that, this lifestyle seems to be incredibly strict for somebody coming from such an unwell background. So I sort of did a 180, and I began working with people at whatever level I think that they were willing to work with. So if this was just restricting bread and removing seed oils, and then, maybe reducing carbs, and then prioritizing protein, and, putting in more natural fats and so on. So through these incremental changes, I think we can reach a wider audience. At least that's the way that it's worked for me. So it's working. I work with vegans. In fact, most of the carnivores that I work with now were once vegan. So, but they weren't willing to resign to the fact that this was the way forward initially. I had to almost convince them, through research, clinical trials, and so on and so forth, but incrementing those changes. And I think we can quite often cut our nose off to spite our face by being too dogmatic within the society. I think we should be willing to work with anyone who's willing to make better choices while educating and informing people so they can make those educated decisions. But I thought that was quite refreshing, because I think within the community, it seems to be all or nothing. But to me, if it was that, I wouldn't be here now, because I wouldn't have been able to sustain the lifestyle,
Yeah.
So
I agree with you. I did a slow transition myself, because that's just my personality. I needed to be able to do it on my terms and my way. And I do think that you lose a lot of people if you have to demand this like purist mentality, especially even if it's like for their mental health. Like, okay, so maybe they need to eat some strawberries to keep them on the 99% of the diet. Otherwise they'll go nuts. Like, I think that's important. And, I have a patient, one patient I'm working with right now, and our meet in the middle moment is just take out raw vegetables just for right now, just the raw ones. You can cook as many as you like, but let's just remove raw, and we will go from there. And again, it's always about how can we get this person optimal health. And most people are they're ready to change because they feel terrible. And if you can show them a path and show them that, hey, even the small step in the direction that I'm leading you is going to be the move that makes you feel better, and then they start to feel better along that path, they're going to come along a lot better, a lot faster. It's going to be a lot easier, I think, for everybody involved.
Yeah, I agree. What do you think, Steve? Do you think we need to be, and I think I already know the answer, but I mean, there's been lots of differences in opinions in regards to the best approach. I'm all for the incremental changes. I think we should just educate. This is the information. But I do believe the softly approach, incremental changes, is probably the best and more successful, at least in my opinion.
Yeah, I think the problem is it's still down to the person, because some people have to be all or nothing, and I just don't think we can say there's a one size fits all. I know what you're saying. You're trying to do sort of like a summary, but I've not made like that. I think, there'll be a few people thinking, no, when I gave up smoking, I gave up smoking. That was how I did it. So, yeah, personally, if someone was not like that, I think a slower transition is going to be more successful, and taking out bits, yes, that's going to be more successful. But I would still judge it, because, the expression about people want to run before they can walk. When they're really enthusiastic, I don't want to suck that enthusiasm out of them as well. And I think this is like with personal training. And I mentioned it earlier when someone said, should I be ketogenic before I exercise? If I have someone in front of me that wants to start something, I think it's better to say, well, let's do this today. Let's get a workout in today, rather than, well, book me in 4 weeks' time, because that you don't know how their mind works. They might be one of those people that, they're a bit faddy, and if they can't get that instant quick practice, they might never come back, or they might cancel the one in 4 weeks. So, but yeah, in the main, yeah, if you want to be like very sort of broad, in the main, a slower transition works.
Do you know what I would add to that really quickly? And I'd love to get you guys' opinion on this. That there's two kinds of people, I believe: step change and incremental change. Now, I've just described it, an incremental approach to the lifestyle, but I'm a step change person. It's all or nothing. But when I came into this, it was either no carb or all carb. So I couldn't do a little bit of carb. But because there are so many education pieces in regards to saturated fats, cholesterol, sodium, red meat causing cancer, there's so many different things, the phytolectins, plant toxins, we're bombarded with all of these different angles. I just think even a step change person would benefit more to understanding that cholesterol is good, and then understanding, well, sodium is good, and then understanding red meat is good. So even in that situation with a step change person, I think there's an element of this that sort of cascades into an incremental change. Does that make sense? Because it just, people are not willing to accept that the lifestyle is the creme de la creme. Eating meat is the magic elixir and nothing else. I think it's just too much of, there's too many minute questions involved within doing that, I believe. What do you think?
Well, I think knowledge is power for people, but there are people that don't want the knowledge. They just want the result. They don't want to put the effort in. Us three are all, we do what we do because we're interested, and we couldn't do this if we didn't have knowledge, because every question would be, oh, I don't know, it just worked. So but there are people out there that you do try to educate. I've definitely got that in coaching. At least once a week, I'll say to somebody, do you want to know why this is working for you? Like, no, not really. I've lost a couple of kilos. My trousers look better, whatever. And they're happy with that. But we're not made like that. And I do think carnivores in general are more open-minded and more interested in, the politics behind it as well, and other things like grounding and loads of things. Anyway, look, Dr. Sabrina has gone over time, because we booked you for 45 minutes. So we don't want to take up more time than we've got. So is there anything you'd like to say to sort of wrap up your section?
Well, I'm glad you guys did it again. I think when we did it last year, I was like, you guys should do this next year. And you did it. And I'm so happy to be back. And I'm much less pregnant. And, I think this is fun. Like, this is a really great thing because it allows people to get a vast amount of knowledge live, real time, throughout one big period, and no time like the present to make changes. And I hope that this just like really served people in a really great way. I think it's wonderful that you guys did this, and maybe next year again. Yeah.
But do you know, until about an hour ago, I was convinced that I was going to, and then I think hour 17 hit me like a ton of bricks. But I feel like I'm having, I don't know, probably the fourth wind now, not even the second wind, but who knows? We'll see, Steve.
Metabolically optimized, you're running on ketones, your brain's lit up in all the best ways. So yes, you got this.